Good morning. My name is Erin Murphy, and I am the chair of the Committee on Public Health, Homelessness, Recovery, and Mental Health. I want to remind you that this public hearing is being recorded and broadcast live on Xfinity 8 RCN 82 in FiOS 964 and streamed on www.boston.gov/city-council-TV, and will also be rebroadcast at a later date. Please, if you're in the audience, silence your cell phones and any other devices. We will also take public testimony and ask that you sign in to testify or to register your attendance. Anyone that would like to testify virtually on this matter, please email juan.lopez, juan.lopez@boston.gov with your full name for the Zoom link. At the start of your testimony, please state your name, address, and affiliation. Today's hearing is on docket 0148. This matter is sponsored by Councillor Gabriela Coletta and Councillor Ruthzi Louis-Jean and Councillor Ricardo Arroyo, and was referred to the Committee on Public Health, Homelessness, and Recovery on January 11th, 2023. So I will read the docket summary and then we can get started. So this is an order for a hearing regarding contraception and menstrual product vending machines in the City of Boston. I know that the co-sponsors will explain more, but we will be focusing on this hearing just on the menstrual product side of this, because we will be filing, or they will be working different avenues to work around the contraceptive products. So with that being said, I am joined this morning by my colleagues and sponsors, Councillor Ruthzi Louis-Jean, Councillor Gabriela Coletta, and Council President Ed Flynn. Thank you for being here. I will quickly just do my opening statement as a mom of one daughter. And I did, on my way out here, ask the young women in my office if they had any good opinions. I'm past the age of needing these products, but know that we have to always be strong advocates. And everyone was saying, yes, absolutely, any way to make this easier. So I'm just looking forward to this conversation. I'll share more as we get there, but I'll get right into opening statements, and then we'll introduce the administration panel. Do you want to go first, Scott? Yep.
Thank you, Chair Murphy. I'd like to thank my co-sponsors, Councillor Louis-Jean and Councillor Arroyo, and also Councillor President Ed Flynn for showing up and being such a strong ally and supporter of women and folks who identify as women. I'm going to do some table setting because there has been some welcomed attention on this topic, and we love talking about it because we want to destigmatize as much as we can, right? So there are two components of this hearing order that we filed late last summer. The first, which will be the focal point of this discussion, as Councillor Murphy mentioned, is to discuss what it might take to provide free or affordable menstrual products across the city in easily accessible vending machines. Menstrual products are necessary for half of our population and essential to personal and mental health. Period poverty, or not being able to afford menstrual products, is a common concern for low-income menstruating individuals in high-income countries. According to a 2021 study published by the BMC Women's Health Journal, many young menstruating individuals cannot afford products to meet their monthly needs, especially Black and brown people of color. This may impact their mental well-being due to the shame and stigma associated with a lack of income or accessibility to these products. As an aide to my predecessor, I was very proud to work in partnership with her then Councillor Lydia Edwards Councilor Matt O'Malley and Councilor Anissa Sabi-George to call for menstrual equity in all of Boston Public Schools. Ultimately, due to their efforts, we secured $100,000 in the FY20 budget to provide menstrual products in BPS, which was a huge win at the time. And I have to say that nobody was talking about this, and we were met with a lot of eyebrow raising, but it was something that we knew needed to happen, and I'm very, very proud of that. There are incredible efforts taking place here in the Commonwealth at the state level as well. In a short time, we'll hear from Sasha Goodfriend about her dogged advocacy around the I Am bill, sponsored by Senator Pat Jalen, Rep. Livingstone, and Rep. Barber, that would provide access to free menstrual products to all individuals in schools, shelters, and prisons. Boston can and should be a leader in our space. This is our opportunity to be bold and to be creative. As I was initially researching this idea, I was very pleased to hear that the Mayor's Office of Women Advancement is already working on something like this, so I look forward to hearing from you all. And so, as Boston considers this idea, we need to consider who we are trying to serve and where some of these menstrual and reproductive healthcare deserts are. Additionally, the second part of this order is considering what it might take someday to get over-the-counter methods of contraception in these vending machines when they do become a reality. In the fight for bodily autonomy, everybody should have the right and have the power to choose if, when, and under what circumstances they wish to get pregnant and carry a child to term. This is not a new idea. In the city of Boston, Boston University recently launched Plan B vending machines on their campuses, offering it to students at a lesser price than what they offer over the counter. Boston Public Schools already supplies our high schools with access to condoms with a parent or guardian opt-out program. So we have an incredible opportunity here to leverage our existing efforts and to meet this moment in our country where our rights nationally are being pulled back. And so I really, really look forward to this conversation. I want to thank the chair for making time on the calendar, which is so difficult, my co-sponsors and my colleagues for supporting this, and thank you all so much for being here.
Thank you.
Good morning, everyone. Very happy to be with you all this morning to be talking about how we can ensure the city is meeting the needs of all of our residents for women, for folks who identify as women, for everyone in the city of Boston who has trouble accessing menstrual products and contraception. As my councilor colleague stated, the sponsor of this hearing is going to be focusing on menstrual products with more work to come. We all know that with the decision in Dobbs v. Jackson, which roguely overturned Roe v. Wade, the U.S. Supreme Court overturned 50 years of federal constitutional abortion protections. Because of this unprecedented rollback of reproductive rights across the country, we need a whole-of-government response to fight back against attempts to restrict bodily autonomy. Defending these rights at the federal level is not enough. States and municipalities must take immediate action to expand reproductive health equity and health justice. I'm grateful to the sponsor and to the administration for their initiative here in making sure that we are addressing period poverty and making health equity a cornerstone of the administration and the work of the council. We've already seen, as Councilor Coletta stated, we've already seen colleges across the Commonwealth take the first steps, so we know that this can work. And so this is part of a conversation that a lot of our nonprofit organizations have already been leading. I look forward to hearing testimony from Sasha. I know that Love Your Menses has been doing an incredible work on this issue, especially for Black and brown young girls and women. And so I look forward to further meetings and working sessions where we're able to bring folks in and really talk about the work that they've been doing and how this will open up the doors and really reduce stigma. I can tell you this, as a city councilor, I'm often like having to, I as a whole adult, the stigma is still real, right? Walking into, I've had to text Councilor Coletta, do you have any on you? Because and I think that if we had it publicly available, right, it would take that away. If we were just always available in the city council bathrooms or always available, I wouldn't have to do that. And the stigma of not being comfortable talking to this around our male colleagues, right? Our male colleagues would not exist if periods were not a reality in this world, right? And so I look forward to your leadership to making us all feel more comfortable about having these conversations. Public access to menstrual products breaks down barriers to care and fights stigma around sexual health. And we know that There are health deserts where Black and brown residents face limited access to these essential health tools. So thank you again for everyone for being here, for the Office of Women's Advancement, for the work that you'll do, and for our partnership here. And I look forward to this discussion.
Thank you. Council President Flynn.
Thank you, Madam Chair, and thank you to Councilors Coletta, Louis-Jean, and Arroyo for sponsoring this important hearing, and for Councilor Murphy for chairing it as well. I want to say thank you to the team from the Wu administration for being here as well, and for the important work you are doing in the city. As my colleagues stated, I think everyone should have the freedom to decide when they want children and have access to contraception. Yet for many, contraception might be difficult to obtain and can be expensive to get. So there should be ways of ensuring access to contraception, like vending machines, which might offer less expensive contraceptives. This is an important part of that freedom. Menstrual products can be expensive, but necessary. And for many, this is a monthly need that can add up in terms of expenses. For low-income girls and women, being unable to afford menstrual products impacts not only their physical health, but also their mental health as well. It is important that we explore ways to ensure that menstrual products are accessible and affordable. I'm glad that we're having this discussion. I want to again say thank you to my colleagues for sponsoring this, for the important work they're doing. And although I'm not able to stay for this entire meeting, I do plan to listen and watch the video later this evening to learn more about the hearing. Thank you, Madam Chair.
Thank you, Council President Flynn. So we will have two panels today in public testimony. Our first panel will be the administration panel. So when you start, just please state your name and your office you work at. We know here, but just for those watching in, and you have the floor. Thank you.
Thank you so much. Alexandra Valdez, Executive Director of the Mayor's Office of Women's Advancement. Such a pleasure to be here, and thank you all for holding this hearing. It's so important. I on my way home, on my way to work, I was thinking, it's so amazing that we're having this conversation in City Council chamber, and so amazing that we're having this conversation together. And how do we think about accessibility? How do we think about making sure that products are available in every single neighborhood citywide to assure that we're supporting our menstruators all over the city, which is so important. I'll just talk about a couple of initiatives that MOA has been underway. In the fall, we partnered with Love Your Menzies to specifically focus on the education piece. It's so important to think about how we're educating our community members and how we're thinking about that stigma of how it's okay to have conversations, and it's okay to make sure that we are having them with specifically with men as well. And we partnered with Love Your Menzies to actually educate, and we did a workshop titled Men for Menstruation. And it was a citywide workshop where we were able to have an honest conversation on how can men be allies, but at the same time, how do we educate on the importance of menstrual products and the importance of menstrual poverty around the citywide. And it was very, I was talking to one of my colleagues earlier, as it was an honest conversation. And it was an opportunity for everyone to be honest in the sense as to ask questions, right? And actually talk about what they don't know and talk about how this conversation makes them feel. And also just brought it out into perspective how it is so important to think about that education piece and how it's so important to make sure that these conversations are being had broader. In the fall, we also had the opportunity to partner with Best Now and Tasha and hosting an amazing period pop-up here in City Hall where we had artists from all over the city showcase the importance of also showcasing visibility to this issue. And it also brought into perspective, how do we continue the conversation and how do we do it in a way that we're also continuing to educate? And it was an amazing pop-up that was here in City Hall for a little bit over a month where we had an amazing reception to also bring in and uplift even more. and to think about how we as a city are focusing on helping our young girls, our menstruators, specifically those in underprivileged communities throughout the city. MOA has continued to partner and think about what other ways we are supporting and we are uplifting this specific issue. And we do have some projects underway and some initiatives, and we really, really look forward to think about how do we work together, how do we also amplify the issue, but better yet, how do we helping our menstruators citywide to make sure that we are providing free menstrual products in the city.
Thank you. Do you want to present or will? Okay, awesome. So we will do some questions.
Yeah.
I'll start with the sponsor, Councilor Coletta.
Thank you so much for that opening, Alex, and I just want to say thank you for your work as well on this. You've done an incredible job. The period pop-up was awesome, and then the Men for Menstruation was incredibly creative. So thank you for that. I'm happy to hear that it went well. Do you have any ongoing projects that you can speak to, specifically as it relates to providing access to these products? Has there been any discussions that you can say publicly about putting these on maybe city land? And where have you considered placing these sort of products?
Yeah, we have had a lot of conversations as to what it would look like for us to even think about having an initiative. So we originally had conversations internally, also externally in city-owned buildings as well, as what it would look like for us to have these in city property and also offer them for free. We're still figuring and tightening a lot of details on the specific initiative, but we're definitely really excited to publicly say that this is a project that MOA has been working on for a couple of months and something that we're really excited to be launching in the near future.
Okay. And have you identified any locations that are either menstrual or contraception product deserts? I know that there's been a lot of talk about the closing of Walgreens and CVS's, specifically in Rosendale, High Park, and Mattapan. East Boston, there are some places where there are food deserts, right? There's not even any opportunity to get food or any of these products. So have you identified any locations in the city of Boston where you might be able to place one of these vending machines?
Yeah, so we actually have been looking at a lot of data, specifically focusing on all the different Mattapan, East Boston, Roxbury, Dorchester, and looking at other places as well. We started looking at foot traffic on what does it, specifically at BCYF centers. I mean, that's nice data that we can grab and actually take a look at, and that sort of helped us think about if this is a foot traffic, what it looks like in a BCYF center, imagine what it would look like in other city-owned properties. So we started reaching out to libraries, BCYF centers, and other city-owned buildings to be able to look like, what does foot traffic look like here, and what would it mean to think about offering free menstrual products in specific city buildings.
And if you can talk to me theoretically, right, if we find a vendor, right, we put out an RFP for this. Right. Can you walk me through next steps of what those conversations might look like and how we can materialize these vending machines in the city of Boston?
Yeah, of course. Most importantly is being able to find funding, right, to be able to have the RFP. It will be specifically, we will have vendors come and apply, and the best bid will be selected, obviously, by, it would be an application, making sure that it's very well aware throughout the city, and the next step would be to actually sit down and think about locations. And where are we thinking citywide? Are we thinking specific locations, whether we start with specific neighborhoods, or are we thinking of doing a larger pilot, more concentrated? And depending on who the vendor is, thinking also about the type of machine, and also thinking about in how many places. One of the things that is also to consider, right, is that not every menstruator uses a women's bathroom, and not in every location there's gender-neutral bathrooms. So also thinking about into perspective about also making sure that depending on the location, products are offered in multiple locations inside that building. So that would be another conversation to have, whether if we hypothetically choose, let's say, for example, City Hall, or whether that's a BCYF center, if that specific location doesn't have gender-neutral bathrooms, how many and where are we putting the menstrual products? And that's another great conversation to have. And then how many locations we're looking at and how much cost is going to cost us depending on the type of machine that we choose to have on the specific location.
What funding measures are currently available for initiatives directed at doing something like this?
So right now, MOA is specifically working from our past fiscal year budget. Our budget is a little bit restrained for this fiscal year. For FY24, we have definitely put into our budget specific for this specific programming, but thinking at a larger spectrum and what it will be in RFP, definitely that should be a larger conversation on how we think about allotting more funds to it.
Okay. We're about to enter our budget cycle, and so this is something that is a priority of mine, and so I'm really curious if you could tell me ballpark how much a pilot program would cost in the city of Boston if we're thinking maybe 5 locations. And I know it depends on the machine in particular, right? But if there's a ballpark range, then I know how to be effective in my advocacy and mobilizing my colleagues to support it. Because at the end of the day, we want this to materialize and we want to support you in this work. So I don't know if you have an answer for that.
Yeah, I mean, it's really hard to tell, right? Because it also depends on how much product we're using in each location. We can say, I have looked at companies that have charged all the way from $8,000 per machine to $10,000 per machine. But it also depends on how much product we're putting into the machine on a monthly, weekly basis. So those are numbers that, depending on machines are even put into specific places that we will have to document and say, well, X amount of products have been used in this month, then we will need to reorder again. Or X amount of products have been used in this week, then we will need to reorder again. And also really depends on the company as well. Some companies might have other machines that might be cheaper or a bit more expensive. So I think thinking about a ballpark, I would say, based on the numbers that I have seen from other companies, that's sort of what I have seen so far. But again, really much depends on how much product is used on a monthly and a weekly basis as well.
Okay. And have there been specific conversations about what products we would provide? I know tampons, pads, right? Have you discussed contraceptives with anybody? What does that look like?
Yeah, it's something that we are definitely very much open to having the conversation. As important as menstrual products are, we want to make sure that we're also opening the door for other products as well. So MOA is more than happy to think about what would that look like, and also what would funding look like for that specific product as well.
Okay. So just to summarize, you all, just based on this project and this program, you're really thinking about city municipal buildings,
yes,
or outside city municipal buildings, or wherever there are gender-neutral bathrooms or just bathrooms in general, right? So you're thinking BCYF, right? Is BPL a part of the conversation? I know that there's a high level of foot
yes,
traffic through our libraries.
Yes.
Okay. Is BPS part of the conversation?
Yeah, everyone has been really much a part of the conversation. It's such a broader topic that it's when we initially started having our conversations, just bringing everyone together was so important because I know that there's a lot of people doing a lot of work around the space. So everyone has come together, yes, to have these conversations, which is amazing. Definitely makes us making sure that we're all on one page with a lot of this work.
Okay. And my last question, and then we can go to my co-sponsors, but do we have any data, and this is for the BPS menstrual equity component of this, but do we have any data on BPS providing these projects through school nurses? I saw a stat from the IAM website that school nurses pay a percentage of their own salary for these products. And so I'm wondering if we have that data anywhere. And this might be a question for BPS, but I don't know if you have it.
Us personally in MOA, we do not have that data, but I'm sure that we can find a way to obtain it. Yeah.
Okay. Thank you.
Yeah, thank you.
Awesome, thank you. I'm going to go to Councilor Louis-Jean, but I do just want to acknowledge that the third original co-sponsor, Councilor Arroyo, has joined us, but you can go, Councilor Louis-Jean.
Thank you, and thank you for your answers thus far. Thank you for your answers thus far. I think Councilor Colella asked the bulk of the questions that I wanted to, but I wanted to ask a bit more about, it's always important when we're having these discussions, the acknowledgement that it's doing is innovative, but we're not the first.
Right.
And that it's happened, and that there are models that we can learn from. And I wanted you to talk a bit more about the models that we see here in Boston with respect to universities or other cities that are getting this right. I'm sure that there are others. And so what has the work been? What work have we done to see the models that exist at other universities and around the country?
Yeah, so just as of right now, when MOA has done a lot of work, we have seen even current private companies as well as through Love Your Menses organizations and city organizations that have done this product, whether that's partnering directly with a nonprofit like Love Your Menses to also include products, but the same way also provide the educational piece. That's also done very well. When we think about, yes, we have the free products and the bathrooms, but how do we attach the educational piece behind it where we're also teaching menstruators and everyone in the community the importance of having this conversation. We have also seen, like we mentioned, the vending machines in Northeastern, which has worked tremendously. It was an amazing outflow by the students, everyone around it, and it has received amazing feedback from students.
And Director, can you remind me what products, because I think, Councilor Collada just spoke to tampons and pads, what products are in the Northeastern vending machine? Do we know?
If I'm not incorrect, I believe it is menstrual products, but also contraceptives and other feminine hygiene products.
Yeah, I think so. Boston University has Plan B machines as well.
Mm-hmm.
Thank you. And are there other cities that have done this and have executed it in a manner that we want to learn from, or is that additional research that we have to do?
Yeah, we have had some conversations with additional cities. MOA has had some conversations with Somerville, some conversations with DC and New York, and it's something that, yes, they have piloted in different ways, but at least from conversations when we have specifically New York and DC, they do offer some free menstrual products, but they're still thinking about how to think about it broader and more innovative to be able to make sure that it's accessible everywhere. It's great to say that it's a conversation that, like you mentioned, we're not the only ones having them.
Yeah.
And there have been so many ways to look at it, but definitely looking at different ways of how do we do this in an equitable way to make sure that everyone has access to these products.
Yeah, and I think it's important, and even though we're not the first, I think it's still pretty radical and bold and important for us to be doing this work. So, but there's always a lot to learn, especially from folks who have made the same, done the thing and made mistakes and learned from the thing. It helps us, and I think it's all about just learning from each other and doing the work and solidarity building. So, and so you touched on this too, right? There's this important education component to making menstrual products more available. We also need to make sure that we are, considering those where there's not a lot of English proficiency. Right. So what are we, are we thinking about? How we make the health education more accessible to immigrant populations, to folks for whom English is not their first language?
Of course. I mean, thinking it's something that MOA is so passionate about, to making sure that everything that our office is put out is making sure that and language is not a barrier, or why a person should not be able to access information or should be able to even access products. So this is something that's definitely at the top of our priority. Whenever the pilot or initiative initiates, or however that looks like, or when we decide, depending on budgeting, what an RFP would look like or that educational piece would look like, making sure that we are not just be able to translate, but also hold information sessions in different languages, make sure that all of the materials are translated in a top 10 languages in the city of Boston is so essential. We want to make sure that, like you mentioned, it's available to everyone, and that language is never a barrier why someone should have access to information and, better yet, the products.
Thank you. Director, I think Councilor Collada asked a variation of this question, and you addressed it in your opening, and I talked about it too, like how making them more available really also gets at the stigma and the shame that is often associated with the fact that this very biological thing that happens to women and folks who identify that we don't have these products more widely available, and that one of the things that I saw that I thought was very successful around in the reproductive rights movement was just say the word abortion. Just say abortion, say abortion over and over again. I wonder if there's a similar sort of public campaign that we can do here to reduce the stigma like I said, even with me sometimes as a whole adult, like how do we, and I think the Men for Menstruation event it was a really great way of doing that. But if there are other ways that you think that, like, you know, we're elected officials, we talk to folks, do you have any tips or advice for us, you know, or, you know, what we can be doing as a city to get at that issue?
Yeah, I mean, just having more of these conversations, I think it's so important. And having the opportunity to openly talk about it, and openly talk about it in spaces where originally these conversations would not have, especially within our immigrant communities, around ally and men, are so important to think about how we're supporting our young girls or menstruators, or even how are we supporting our own families or young girls coming up now. And it's so important to have these conversations and just bring in awareness, and also looking into what are other nonprofit organizations doing that we can also be elevating their work, and how we can continue to be advocates around their work as well.
All right. Well, thank you, Director Valdez. I think we're going to hear from some great organizations who are partners who we'll learn from, and we'll hopefully learn more in other meetings and working sessions. But Director, I appreciate all the work that you do on behalf of women in the city of Boston and your tireless advocacy, and it's always a good thing when we're working on something that the administration is working on as well. So thank you. Thank you, Chair.
Thank you. Councilor Arroyo?
Thank you, Madam Chair. I want to thank Councilor Coletta and Councilor Lujan as well for their leadership on this. This is something that's incredibly important to me in terms of what and how we are impacting our city moving forward, and how we are leading on an issue here that can be a model across the country. One of my questions specifically on this is the Public Health, Homelessness and Recovery Committee, and one of the things that I have sort of been frustrated with is the State House had a bill, essentially the IAM bill, that didn't make it through, I think in 2019, 2020, whose goal was to provide menstruation products or menstrual products during and for people doing prison time in our county prisons, in our jails, folks in our homelessness centers, and in our schools. Is there a way to work in partnership with our homeless shelters or our homeless population with this kind of a program? Is there a way to sort of work in private-public partnership? Most of these are like nonprofits, but to ensure that the city is doing something to help sort of meet that area of need, which is specifically with the homeless shelters within our communities?
Yeah, I think that there's a great opportunity for us to work with specifically women's shelter. And also thinking about the need, right? And a lot of nonprofits do a lot of this work and that focus, but as a city, how do we make sure that we are engaging and actually finding the organizations and the shelters that are actually needing menstrual products? I think we would think about step one. And then thinking about cost-wise, what it will look like for us to provide menstrual products to them. And also think about what other city departments are already working with women's shelter to think about providing these products. I think it's something very important to look at, what other city departments are also looking into women's shelters and providing menstrual products.
Yeah, it would just be good to know where that need, because I think there are a number of nonprofits that might be trying to help step into that void as well.
Right.
But I think where they're not doing that, the city has a responsibility to step into those voids. And so it would just be good to know that one side is talking to the other side, and then we're getting a sense of what the need is and where that need still is maintained. To move forward on that. I think a lot of the questions about budget, or more statements rather about budget, have been asked by Councilor Coletta, but obviously it would be wonderful to have some ballpark number. The council has more power on the budget than we've ever had in the past, essentially to move money around and to adjust budget in different ways and to add amendments to the budget. And this would be a worthy thing to do that for, so it would be really good to have some sense of what the numbers would be to have the city do a pilot program on this, specifically for supply, for the machines, and for those partnerships, whether or not they require, for instance, the maintenance of those machines, right, the stocking of those machines. Whatever we think a ballpark number is on that at some point would be really good. I'm not sure if you have one now. I heard some of that, but I think it would be good to know now that we're heading into budget season what this might need to actually get off the ground.
Yeah, I'm more than happy to provide some information from the research that we have already done, and be more than happy to share those numbers.
Which is great. One of my questions was already asked about locations. It sounds like you're thinking about BCYF, Boston Public Library, Boston Public Schools. I'm assuming City Hall is also on the agenda. There's a program out of Brookline that they think, I think it was 2019, where Brookline makes sure that there's, and I think this came up with not all people who need menstruation products use the women's restroom, but I think there's an equivalent where we can do something similar around our public restrooms, but they require them in all of their public restrooms. And so I think there's a question on obviously maintenance and getting that done, but is there any appetite for doing that, say, with our public libraries or City Hall as a starter, and making sure that we maintain that program for all of our sort of public restrooms, that we are able to sort of work into that. We're much bigger than Brookline, but making sure that we have that access, I think, is incredibly important. Is there any conversation or movement to sort of increase where we do it and make sure that we're doing it in more locations?
Yeah, of course. I mean, like I mentioned earlier, not everyone who menstruates uses the women's bathroom. And it's so important that if we do have this conversation and this pilot does move forward, that the products are offered in different locations, that they're offered also in men's bathroom, gender-neutral bathrooms, and also non-bathroom locations, make sure that they're being accessible. So, of course, that's definitely part of the conversation.
Yeah, and I see this as a big part of getting sort of this out of bathrooms and more into public spaces with the ability to sort of put it in a public way. I think one of the things that I've been made more aware of through sort of my sponsorship of this is the stigma around menstruation. And so I guess the question is there any programming that the city is doing directly to address that? And if there is, would that benefit from increased, in the same conversation that we're having about budget, but increased resources? Or is it a situation where we haven't done that and we need to sort of create a pilot program to sort of deal with that? Is that, like, where are we at on just working on stigma education work?
Yeah, so MOA has had the opportunity to partner with nonprofit organizations like Love Your Menses, where we have hosted and Men for Menstruation workshop, where specifically to talk about that stigma and to also bring awareness on the importance of having conversations with others who are not menstruators, and how do we think about educating, how do we think about supporting, and also how do we amplify and bring more attention to this issue in a way that we're making sure that everyone has an opportunity to speak on it, but yet learn how do we have proper conversations and how do we do it in a way that we're educating our residents.
And then just the final aspect of this for me, obviously we're very aware that it's probably never been a worse time right now in terms of the environment, on the laws around and where we are at on sort of reproductive health. One of the things that I'm aware that our universities do is they do have sort of subsidized machines for contraceptives for both men and women. Things like Plan B, things that make it easier and more accessible for individuals. I think the idea here is to start with menstruation products and then sort of figure out where to go from there. But is there a lane essentially for the city to take a role in making sure that folks have access to contraceptives, making sure that they have access to things like Plan B, making sure that they have access to these things in a sort of destigmatized, more accessible way? And the reason I say that is we do have contraception, sort of reproductive health deserts in the city of Boston. We have a separate but sort of related issue, which is Walgreens has left certain areas. And so I think there's a priority on making sure that in all of the places that are dealing with this issue, that Boston is becoming the most accessible and the most successful at championing these issues. So I think that there's some goal or priority for menstruation and menstrual products taking a lead as a pilot and then sort of working into contraceptions and these things. And I would second that. I would agree with that. But I do want to make sure that there is some plan moving forward to make sure that we are making these things accessible.
Yeah, I mean, we would love to think about what it will look like and even have those conversations. I think it's starting with menstrual products it's key. We're opening the door to having that conversation, and then having the conversation of contraceptives. I think it's a great one to have as right after we see how successful the whatever program that it is that we're doing, and see how we're inputting into it citywide. I think
Yeah, no, because it's obviously related but not the same, and so I want to make sure that we're giving both of them the sort of attention that they're both supposed to get. Thank you both for the work that you do. Really appreciate it. And I look forward to getting something back on numbers. Every time we ask somebody from the administration what they need, they're always like, no, I'm great. I have an abundance. So please don't fall into that trap. Just tell me what you really need and we'll make sure we do our best to get it to you.
I will make sure.
Thank you.
Great, thank you.
Thank you.
I just have a couple comments, questions. And thank you to my colleagues for asking such great questions. We already got a lot of good information. We know that our city doesn't run without our partnerships and nonprofits and our community centers. And I know when the conversations here on the council, it mostly is just around the budget that we control and the departments, like was brought up, BPS, Boston Public Libraries. But do we already have, or are we thinking of having a partnership? Because I know community health centers, often many of the ones I know offer contraception and free products. So are we going to work maybe with them also, or other I know we're going to have some panelists who are nonprofits, but I'm thinking of our community health centers who are, they're so big in every neighborhood that has them.
Yeah, that's such a great point. I mean, it would be ideal, right, to make sure that community health centers are part of the conversation. I definitely think when it's time to think about this at a larger spectrum, or whether we think about it citywide, or whether we're thinking about a call to action, having community health centers at the table is so important. So I think whatever the next step is, whether if it's a pilot, whether if it's an RFP, whatever we decide, I think making sure to have community health centers at the conversations is so important, because like you mentioned, Councilor Murphy, a lot of them already offer products and they offer them for free, and it's how do we amplify that, and how do we make sure that we are letting residents know that it's something that it's already being provided.
Right, and I'm thinking also if there's an education campaign, because they're the nurses, doctors, people working with these women, young girls. Couple other things, and I know your work with Matt O'Malley, but I was proud to take over the Impact Melanoma, which is what I was thinking of when we talked about others who are doing this, and I know Councilor Louis-Jean mentioned it, but there are other nonprofits, they're not offering menstrual products, but in this case, we've partnered with them to get into museums around the city with, the sunscreen dispensers that are free. That same idea of there's a product, people need it, it saves lives in that case, in other ways. So how are we partnering also with, or maybe working with those types of nonprofits who are doing a similar, it's just an idea that we could maybe bring those people into the conversation, because they're very successful at expanding that program and working with DCR and, outdoor parks and around the city, but also, high foot traffic. They have the data, so I'd love to connect with that information we have there. A couple other things you did, and I appreciate you highlighted school nurses out of pocket. I know classroom teachers also. So we'd never get a real number, because unfortunately teachers spend a lot of money out of pocket, and nurses. And I was thinking also, our community centers staff, if girls need something, if anyone needs something, most of the people working in these spaces just pull out their own wallet, unfortunately. So it's hard to track what's really being spent and what needed. So just want to thank you for highlighting that we do know that there's lots of people already knowing that there's an issue. And when we go to food pantries, we have dog food and cat food now. We also have diapers. A lot of nonprofits do diaper drives, because we know that alone can wipe out your budget. But menstrual products too are being offered. So making sure maybe partnering with these great food pantries to have maybe menstrual cycle products. So when people are going to do maybe many of the food pantries that I've worked with or are aware of, they have return families every week. It may be a Saturday, Tuesday, Thursday distribution. So maybe kind of working with donations to food pantries that are already working directly with families that would be in need of this. And one just last plug, I don't know if anyone saw it, but I know it was pretty life-changing, that Netflix movie that was by the Pad Product. It was the Academy Award documentary. It was called Period, End of Sentence. Everyone should watch it. It's pretty eye-opening. And even though it's, you know, in India and other places, it affects so many women and families here the same way, that it can just stop you from living your life fully, and that's just unnecessary here in Boston. So thank you. If my colleagues, are you good too? Yep, absolutely. So we have a couple more questions before we set you free, but thank you.
No,
Yeah.
I was going to say the exact same thing. Sorry, I promise we'll let you go soon. Just, and I'm so grateful to my colleagues. It seems like we're all aligned, because my line of questioning is very similar to some of what's been said. So I'll have two things and then just a comment to anchor us and motivate us moving forward. So in the interim, it sounds like there's a long runway to getting a pilot program in this fiscal year, right? That's the goal.
Yeah.
Is that pilot program. And then also, while the IAM bill is circulating at the State House, right? Yes. I feel like there is an immediate need and an urgency to provide these products. And so, correct me if I'm wrong, from what you had said, it sounds like there was some leftover resources or funding from last year's budget. I'm wondering what the possibility might be for us to just make these products available, right? Similar to what Councilor Murphy and Councilor Arroyo was just saying. I'm so happy you brought up community health centers. East Boston Soup Kitchen is doing this already. They're providing tampons and pads, and I'm telling you, the faces of these women light up when they see this, because it is just so expensive and the dollar is not going as far as it used to. So can we just, with the money that we have, buy these products and give them to the East Boston Soup Kitchen, women's shelters, while we have this legislation going through, and then thinking about partnering with CBOs or maybe nonprofits like Big Sister, Little Sister, Girls Inc., Girl Scouts, things like that. Is there a possibility for that, and would you be committed to looking into it?
Yeah, I'm happy to look into it. I think it would be nice to ask procurement and how would we do it in a perspective, making sure if it's over a specific amount, how do we order, or how do we look into it? So yeah, more than happy to look into it. I think anything that we can see and offer in products, I'm happy to say yes.
Thank you. Can I just ask for a formal follow-up to the chair,
Sure,
just to talk with procurement and figure out how this might be possible ahead of the new fiscal year?
Yeah, of course.
Thank you, Director. And then just drilling into the specifics of funding before we let you go. I know we talked about the machines, but I want to get into the details a little bit, again, so I can be effective in my advocacy with the administration and through the budget process. So machines. So you said $8,000 to, and I missed the last part of the more expensive machines that you were looking at.
Yeah, like I said, it depends. When we were looking at some other companies, it depends. It was ranging depending on the machine and also depending on the type of products. Because if we want to look into environmentally friendly products, that's also more, right? And that's something that we also want to think about. How do we also are offering environmentally safe products? So it really much depends, and also depends on how the usage on a weekly, a monthly basis. So it can range, at least for the companies that we were looking at. But then you have cheaper options that are as well that are not vending machines, that are just dispensers. So I think it's a point of us sitting down, right, looking at all the different options and thinking, yes, there are vending machines, there's also dispensers, but there's also boxes. So it really depends on what we want specifically and what type of, what do we call it, not product, but what type of machine or dispenser we want to have in the different places. So it really much ranges from, we looked at some companies that were not charging for the products, but they were charging for the machines.
Okay.
So really much whether we go with a vending machine or whether we go with a dispenser. We can think about from some of the numbers that I looked at, just dispensers from per location, and we'll look at it maybe from $700 to $800, but these are just like little dispensers.
Yeah.
Whether we can look at it a bigger structure, which is a machine, a vending machine, and it can range from like $8,000 to like $10,000, depending on the type of vending machine that we're looking at.
Okay. And so I'm thinking in maximums here, so that way I can figure out what my ask is going to be. So I'm just hearing $8,000 to, let's just say, I don't know, $20,000, right? I mean, maybe $20,000 would cover some of the products and maybe even 25. So if we're trying to do 5 locations, that's at least $125,000 just for the products and the machines alone.
Yeah.
Community education and engagement and that language accessibility component.
Yes.
Would you need more money for that sort of programming? And then a similar question is, how are you doing with staff right now? Would you need staff members to oversee this program? And what might that look like?
Yeah, so right now, I'll start with staff. Currently, MOA, we only have 3 members of our team. Karina is here, she's one of them. And then Lavi, which she oversees our human resources and a lot of our budgeting. So we are currently down 2 staff members, program manager and a policy director, which positions are posted. So please, I encourage anyone to share and apply. But yes, right? I mean, the more work that we add to the portfolio, we want to make sure that we're also distributing work adequately along the team. So I am never going to say no to more staff members, so yes.
Okay. And then the community education and engagement component of it, would that be a separate line item that your department would need to get this done?
Yeah, I mean, because even if we partner with a nonprofit or another organization who's already doing this work, for example, like Love Your Menses, we want to make sure that we're also compensating for their time and for their work and for their resources. And also we want to make sure that we're elevating them. I mean, these organizations are doing work and it's also costing them money and costing them time. So we want to make sure that we are also uplifting them and also supporting them financially as well.
Thank you so much. Thank you again for being here. What I'll just say from this conversation, what I've gotten is that this conversation exemplifies the importance of dreaming big, but how incremental change can be effective. Right? We're all pushing for this pilot program. I think this pilot program is going to be the vehicle to actually get something incredible done here in the city of Boston. And so from there, I think there will be an argument. Once we do this pilot program and it's successful, the argument is there for more resources and investment. And I think that could really be powerful. And then at that point, once we have resources and investment, we can partner effectively with Love Your Menses, Sasha from Ask Now, and some other folks to continue this. And so that's really the goal. And so I want to thank you again for being here and just thank you for the conversation and your work already on this. And there is much work to be done, right? But we're in it with you.
Thank you so much. And I appreciate just having this conversation. And the partners, Sasha, Ask Now, and Love Your Menses, for already supporting MOA in this work. And I think even the smaller conversations are very important. And if anyone ever needs menstrual products, we always have some upstairs in MOA. So
that's great to know.
Thank you.
Thank you.
Now you know.
It's a sisterhood. Sisterhood
yes.
Israel.
Thank you so much.
Would my colleagues want to add anything more before the next panel?
Just have,
Thank you.
a quick addition. Want to uplift what Councilor Coletta said. Like you have our full support. We want to be in this work with you in partnership for this pilot program. And just really also just overjoyed to hear you talk about compensating our nonprofits that are really doing the work. It is essential that we are not just being extractive and depending on free labor. I wanted to uplift, I think when Councilor Murphy started mentioning it, reminded me that so many of our new arrivals and our migrants are facing this issue of lack of, and it's something a lot of nonprofits have elevated to me, of hygiene products. We also have, now I'm like just, putting out there everything that's been in my head that I've heard about that tangentially even relates, but adult diapers being an issue, hygiene products, and really centering our schools in the conversation. A lot of our schools have these organizations that give out clothing to our students, like Katie's Closet. But even them, they're not in every school, and they're recognizing that a big deficit actually is in the hygiene products, is in menstrual products for our young kids. So it's good to know that BPS is part of this discussion, and there are nonprofits in BPS that are doing some of this work, but that really need that further assistance in how we're providing menstrual and hygienic products to our families, because it's not just the students who are, going in and grabbing clothes, it's the families too. And so if we're able to think holistically about how we're able to provide hygienic and menstrual products to our families and our young people in schools, but also to work with nonprofits that are trying to address this issue with new arrivals, again, with the English, for us to be thinking about what education looks like in different languages. I think there's an incredible role that gap that MOA could stand in when it comes to, I've heard about it from women veterans who talk about the need for us to be providing more adult diapers. So there's a gap, and it's a big one, and there's so much potential for MOA, too many acronyms, but in partnership sometimes with MOA. Hello. Yes. That's the Mayor's Office of Immigrant Advancement. So when we're talking about new arrivals, that's for that partnership to be a deep one, to really be meeting the needs of people who are often forgotten. So thank you for your work and your advocacy, and I look forward to this to continuing this conversation.
Thank you. Councilor Arroyo, are you good?
Yeah, I just wanted to say thank you for the work that you're doing, and I echo their statements about making sure that we're helping to champion whatever work you are doing and whatever the resources required to do that are. And so please do get that stuff to us, because it's a thing where we end up having the city departments come before us and say, oh, well, we might need more money here, or we might need more money there. And then we'll say, okay, great, can you get us that? And they're like, actually, the budget's great. So please help us out.
I will.
Thank you.
Thank you so much.
Awesome, thank you, we appreciate it.
Thank you.
And the next panel of community advocates, if you could make your way down. I'm not sure. Once we get, Sasha, good friend from Mass Now, and Ezreal Walker from Love Your Mensa. Are you here? We can start with you, and if others come, welcome.
Murphy, and thank you all the members of the City Council for making today happen. This is a very historic moment to be talking about periods in the City Chamber, and so I'm very excited to be here. My name is Sasha Goodfriend, and I am the Executive Director of Mass Now, the Massachusetts chapter of the National Organization for Women, an organization that has been building intersectional feminism in the Commonwealth for over 50 years. Admittedly, I have been with Mass Now for over 10 years and working on period poverty since 2016, but it wasn't until 2019 that I had the confidence even to talk to partners in the State House to introduce this legislation. And so this is, of course, long overdue, and we are catching up for all of that time. This docket 0148 for a hearing regarding contraception and menstrual product vending machines in the city is an innovative strategy to address contraceptive deserts and people experiencing period poverty. And in the wake of the Supreme Court's decision overruling both Roe v. Wade and Planned Parenthood versus Casey, we have to be more vigilant than ever in looking inwards at what we could do on the local level to make sure everyone truly has the power to decide if, when, and under what circumstances to get pregnant. But I don't think I was asked to come here today to talk about contraceptives, which has been talked about a lot of times in this hearing room. It's to talk about period poverty. And we've talked a lot already about the shame and silence that has contributed to this being something that hasn't been talked about. So I just want to explicitly thank, once again, Councilors Coletta, Louijean, and Arroyo for bringing this hearing together today. So if period poverty is a new term for anyone listening, I want to share some of the stories that we've heard from menstruators all over the state that might ring true as relatable. We've heard stories from young people and people of all ages who thought they were dying when they got their period for the first time. And we've heard stories from people who didn't have an adult to talk to, and in some cases have even tried to take their own life because they didn't have that education around their menstrual health. We've heard stories from low-income and homeless or unhoused menstruators who've used unhygienic substitutes instead of menstrual products, and this has contributed to numerous reproductive health challenges along the way, which can be confirmed by medical professionals that we've heard from as well. We've heard from people who have heavy flows, they bleed a lot, and panty liners don't cut it. And so we know that when we're talking about how to meet the need of all menstruators, we have to be talking about people with all sorts of menstruating experiences. And of course, we've heard from anyone who's experiencing poverty or who is low income is experiencing period poverty. These are silent, undisclosed choices people are forced to make in choosing between buying food, paying rent, and buying menstrual products. This is what period poverty looks like. And with all issues of poverty, it disproportionately impacts people living at the intersections of multiple systems of oppression. BIPOC, trans, gender nonconforming, people living with disabilities who are unhoused, and these are the people that we want to center in the policy discussions to make sure that if we're centering the people who are most impacted, we're then uplifting all people, all menstruators. Menstrual products are an essential item just like toilet paper and should be available to all menstruators when they need them, which is in the bathroom, not having to ask permission to access a product. Mm-hmm. When we started this work formally in 2019 and we were looking for public data around menstrual access, we could not find anything except for the Department of Environmental Protection, which noted that tampon applicators were taking up a lot of space in landfills. So we partnered with the sheriffs around the state. We partnered with the Massachusetts Coalition for the Homeless and the Department of Public Health to survey school nurses, all of the sheriffs, and homeless shelters about what the state of access was. And we found that over half of the shelters were relying on donations. And access to menstrual products should not be at the whims of charity. And a quarter of the shelters that we surveyed across the state didn't have access to menstrual products at all. The same year, we, of course, introduced the I Am bill, which would make products free in schools, prisons, and shelters. And today, that coalition that is working to pass the I Am bill has grown to over 400 activists statewide and 70 organizations. Last session, the bill passed the Senate unanimously, bipartisan, but we're now at a third legislative session where we need to make sure periods are at the front of people's minds around the policy decision-making table and not a new fringe issue. So I'm thankful that this is a part of that conversation. But I think it's important to give context about where Boston is compared to the state and compared to the country, because we are actually falling behind. Since 2019, 21 states have passed legislation to provide free menstrual products in either schools, prisons, or shelters. In Massachusetts, Cambridge Public Schools started their program in 2016, and since then, now we have Somerville, Brookline, Boston, Fall River, New Bedford, and Salem who have passed policies to make products free in schools. And Framingham, Needham, and Brookline have passed policies to make products available in all public restrooms. So we're not the first, second, or third to be considering this here in Massachusetts. Also, I think it's important to know that Boston is the only city in Massachusetts, or that I've heard of around the country, that models menstrual product distribution off of condom distribution. And I think anyone who has menstruated knows that there is not the same need for menstrual products as there is for condoms. You don't know when you're getting your period. It happens every month, and you can plan a little bit more for access to condoms. And so I think that conflating menstrual product distribution with condoms actually contributes to the shame and stigma and sexualization around period products, which we are actually trying to avoid. And this is not the fault of any one individual. This is a systemic issue that we've all inherited that we need to be addressing in all levels of government. So I want to thank the City Council for opening up this conversation, including vending machines and beyond vending machines, in order to meet the need for all Bostonians. The last thing I'll share is that this year, Mass Now is working for the second year in the city of Fall River with in partnership with the mayor of Fall River, Paul Coogan. And this year we've expanded to New Bedford, thanks in part to a $250,000 grant from the Commonwealth of Massachusetts, where we're able to partner with 25 community organizations, including many of the types that you've mentioned, and in addition, SNAP offices and WIC offices, which are not federally funded for menstrual products, also including DCF foster care families, because menstrual products are not a reimbursable item for foster care families. And so we're able to distribute donated pads and tampons from Aunt Flo. Thank you, Aunt Flo. And we're also partnering with Fihri, F-I-H-R-I, a new Boston-based period product distribution company to buy cups, period underwear, and discs for menstruators of all ages, because we know that these products are new, as well as pads on a roll. Shout out to another Boston-based company, and Viv for Your V, which was, I think, mentioned before, another Boston-based period product company that is making biodegradable menstrual products, plastic-free. So quality of products is really important because they go directly into your bloodline, and if we can do the comprehensive analysis during the procurement process to make sure that those small and growing businesses are already vendors with the City of Boston, that would go a long way towards meeting all menstruators' needs. So thank you so much.
Thank you. Councilor Coletta? Yeah.
Thank you so much, Sasha. I am just blown away by your work. You really have mobilized the entire state, or excuse me, the entire Commonwealth around this issue. And I remember you and I talking about this in 2018, and it really being a fringe issue, but you brought it to the forefront of public discussion. So I just want to thank you for your efforts. And obviously, we had asked Love Your Menses to be here, Lita Health, Dignity Matters, and unfortunately they could not make it, but I am appreciative that you took time out of your day to be here and to talk about some of the partnerships. You mentioned that you did a survey with school nurses, shelters, and prisons, and this is where you found out over half of the shelters were dependent on charity. Do you have any information or data about where they were getting these donations from and how they were sustaining those partnerships and relationships?
Question. We didn't really do granular detail to find out where their partners were, but we've heard from a lot of student universities. There are over 30 period chapters at universities that do product drives. Always and Tampax are, of course, big Procter & Gamble companies that are happy to send out their products, and also brings up the challenge of where are we getting our products from and what quality products are being donated. Dignity Matters has done an incredible job of creating their own menstrual products in order to make the cost more efficient and do donations. I believe it's $1 a person a year on average. So I think that the landscape has also changed a lot since 2019, because during the pandemic, there was federal funding that was available for shelters that was temporary, that allowed them to stockpile on menstrual products. And so we were actually hearing during the pandemic that it wasn't an immediate issue. And now that that funding has dried up, I do think it's important that we look to secure that on local and state levels.
And thank you for letting us know about the partnership with Fall River and New Bedford. Trying to figure out how we can model that partnership. Can you talk a little bit more generally about it, how it came to be, what you're exactly doing with them? I know you talked about the SNAP and WIC office and DCF and all of that, but can you just explain a little bit more about those partnerships with those municipalities?
Yes. Last year, we created an advisory council with liaisons from the community organizations that were serving the people we wanted to be centering. So that was people who are working in DCF offices, WIC, SNAP, homeless shelters, after-school programs, and we used them to help us recruit people to do focus groups so that we can make sure that we were getting products that people actually wanted. We were getting a sense of if people were already receiving menstruation education, and we were hearing from young people especially about the decision to stay home instead of going to school, and what making a comfortable school environment would look like in order for them to have feel comfortable getting access to menstrual products. And a lot of students talked about being scared to ask permission to go to the nurse's office, being yelled at by the school nurse, being charged quarters by the school nurse for menstrual products, and flat out, in Boston as well, not having access to use the bathroom, period, is a problem. We also were able to use donated products from Aunt Flo in order to distribute them to all the sites. What was really great was that in Fall River, after we got the grant, we had applied for the grant with them, and before we received the award, they had enough conversations to decide that at the superintendent level, they were going to make this a policy to implement free products in all of their bathrooms, middle school, high school, elementary school, gender-neutral bathrooms in Fall River. And New Bedford did the exact same thing because they all live and talk, working next to each other, and got jealous of the free access to menstrual products. And so that became a policy at the New Bedford city level as well, proactively. This year, what is exciting and different about the grant is that not only are we able to double the amount of community partners, quite frankly, at this point, we don't feel like we need more data. We already know what the problem looks like, and we already know what the costs look like. The work now is to make this systemically sustainable. And so we're working to train youth and adult organizers, local to Fall River and New Bedford, on our menstrual health trainings. Last year, we partnered with Love Your Menses to do these trainings, and this year we're doing the trainings ourselves with a curriculum that we have evaluations for. And next year, the organizers that we train will do the trainings themselves in the organizations that they're already working with. This is because education in schools is a little bit more difficult to health education to standardize, but we know that community centers is where people are, so we're meeting people there.
That's great. Yeah, this is the second time this conversation community centers have come up. I do think that they're an important voice in this conversation, and so thinking about our budget process, not only trying to get some more money for MOA, but when BPHC is here, this is the Boston Public Health Commission, talking about this and asking them on their priority list, because there's many public health issues that we're dealing with here in the city of Boston in addition to COVID, but this should really be high up on their priority list, and how they're utilizing their budget to invest in breaking down barriers and providing access to these products. So it sounds like in Fall River and in New Bedford, you really were working hand in glove with the school system and the superintendent. Is that correct?
Yes.
Okay.
The school committee had advocates who were working with the new superintendent last year, who the issue rang true immediately for her.
That's great. You're giving us ideas, you're giving me ideas. Maybe next time in this conversation we'll have BPS here to discuss it, because there was that one-time $100,000 investment, but that was FY20. And FY20, we all know what happened. Things, priorities shifted, and so I would like to know the success of that program through BPS, and what the appetite is to expand it and figure out how we can model whatever is happening in Fall River to happen here in the city of Boston, in all BPS schools. I think that's a moral and civic obligation that we have to our kids to provide these products, but then using that as a model to expand it to public buildings and help what Alex is doing in the MOA office. So just thank you for letting us know about that, and you're already giving us things to think through. The last question that I'll have, and then I'll pass it to my colleagues, is if you could have a magic wand, and I know this is kind of a little question, but I guess, well, let me reframe it. What opportunities do you see in the city of Boston? Is there anything additional that you would add to this conversation that we haven't discussed yet? Because you are in this work every single day, you see the gaps, you see the opportunities. Is there anything else that we should be looking at or considering as we move forward in this work?
I think in my ideal world, I would love to see the city make this a priority to end period poverty throughout the whole city. When you work on a bulk scale, like with any business or product procurement, you'll be able to get the products cheaper, and you'll be able to get higher quality products cheaper. When it's so local and each school is doing their own research to find out which product is best for them, it's going to take a lot more time, and it's frankly going to be more expensive for that school to be buying a smaller amount. So I think it would be best for the entire city if with a comprehensive approach, we're then looking at sized products that will have variety for everyone, because like I said before, not everyone bleeds the same amount and has the same experience bleeding. And so if you're giving only panty liners to people, that's not going to cut it in terms of bleeding through the liner. And then bleeding onto the clothes, and then bleeding onto the chairs.
Yeah.
The other thing I want to mention in response to what you were just saying before about PPS is that there's the cost of the dispensers. This is a one-time cost. It's not an every year cost. People want stainless steel quality dispensers that can't be ripped off the wall. So that is going to be a capital expense. The operational expense of menstrual products is tiny in comparison because the use is often less than the budget. We're not seeing that we're providing products for every menstruator's entire cycle. And so that's usually a happier sticker price. In BPS, what's different than Fall River is that the janitors' contracts don't already include changing menstrual product dispensers. And that sticker price might be more than the other two combined. Somehow, janitors in other cities haven't mentioned that as a problem, but it is a problem in Boston. So that's a separate line item, perhaps.
Thank you for elevating that and uplifting that. That's something I did not know. I think that's it for now.
Okay, thank you.
Thank you.
Louis-Jeanne?
Thank you. And thank you, Sasha. I feel like I'm learning so much. Even on sort of what the ideal language is, right? Here, that when we talk about period poverty, when we talk about access, and to make that language more inclusive, just talk about menstruators. So I appreciate you and for that. My first question is maybe a little spicy, but can you tell us why I stated previously that we're not the first, but I didn't know that we were so far from not being the first, right? There's a lot of states in front of us and a lot of cities. Why? Why has it been so hard? Why is this not common sense? Why are we allowing other cities and states to get it right? I have the same question about same-day voter registration. Why are we allowing ourselves a state where we have alleged progressive values, where we want to care about everyone? Why is it so hard for us to get basic fundamental things right?
Great question. I think when we're looking at spaces, leaderships that are predominantly people who have never menstruated, that is usually my first answer. It's not the first thing that comes to mind when you think of poverty. Food insecurity is also. Shout out to the food bank, which would be a great partner for distributing this as a dry good. And when we are looking at leadership that is predominantly people who have menstruated, perhaps it is the internalized misogyny of shame that is still really uncommon to talk about periods in a public space. And so we have all of that to come back and counter and make sure that at the end of the day, when we're thinking about what our priorities are, that periods are the first thing that come to mind. This is hundreds of years that have never been discussed. And so once the conversation starts, it keeps flowing, as we like to say.
Love it.
Because
let it flow.
It's so relatable.
Yes.
If I was in a room with perhaps a lot more people and I said, who, raise your hand, has gotten your period without expecting it, everyone would be raising their hand. But who has talked about that? Probably never. And when we're in a woman-centered space, maybe we feel more comfortable, but then as soon as you're in a co-ed space or talking to other people, all the shame and stigma comes back. And so I think we just need to keep talking about it. And I would also just say government in general is complicated and bureaucratic, and it's just not one line item. It's going to be a line item for so many different parts of the budget, because it's all of these different operational budgets that need to be impacted. And so I think what could be the most impactful is leadership and talking about it. we had that $1,000 headline, but we've never had a statement from the mayor's office since then, for example, either illuminating this as a priority issue. Mm-hmm. And so I think that the council could do a great job in talking to leadership of city agencies, because they don't need to wait for policy. They could come up with the cost analysis themselves. They already know how many bathrooms they have. Mm-hmm. They know what their janitors' contracts look like. Yeah. And we could I would love to see that work being done on the municipal level so that when we have the stakeholders all coming together, we're able to hit the ground running.
Awesome. Well, thank you. That was a diplomatic answer in part, but also a really insightful one, especially for what we can do. I mean, and we are constantly in conversation with state partners, and you're right, to cabinet chiefs. And so I appreciate that. And I think we take that as action steps. And so I appreciate that as well. You talked about, and this is also education for the record, you also talked about the types of products and how we can be intentional in the procurement process about what are the best types of products for menstruating people depending on the flow of their period, depending on like if they what they prefer to use, and you talked about the environmental, like so there's an environmental angle here, and I'm not asking you to be a walking advertisement for a type of product, but if there are, you know, what do you think is, when we're thinking about putting both our environmental hat on, our equity hat on, important for us to do both at the same time, what are the products that we should be trying to put into our public spaces, and what work do we have to do? Because oftentimes the best products, right, that takes into account the environment and that takes into account a woman's health. This is something that some of us are inserting into our bloodlines, into our bodies. What are the best products that we should be aiming for in procurement? Also, I mean, just shout it out to share some information with us, but also there's probably work there to disassociate some of the brands that we know and products that we know from what is actually the best for us from like a health perspective, from an environment perspective. So just wanted you to dive a bit deeper on that.
I think in an ideal world, we would not go with the Always and Tampax company, for example, because I think that from an anti-capitalist perspective, they are probably contributing to poverty in the big scheme more than some of the newer companies that we have the opportunity to work with. Viv for Your V was started just 3 years ago by a BC grad. She's younger than me, and she's incredible. These are the only products I know of that are biodegradable, which is what we want at the end of the day, so they're not in landfills. And I'm sure because they're biodegradable, they're probably not the cheapest yet. You know, it's a new company, but I think that there could be an opportunity with a contract as big as the city of Boston to think about what I would love to see what that looks like. They're focusing on tampons and pads, and I believe they have cups right now, but I know that they're in the product design stage of more products. Fihri is Fihri, started by Jalen Rowe, also within the last 3 years, and they work with companies all around the country, and so they're able to provide more variety in terms of a better cost for for discs and cups and underwear. And OnFlow is probably the most popular menstrual product distributor around the country. They work with probably the most amount of schools around the country, school systems, and so they also have probably one of the more competitive prices for secure dispensers, but they have little variety in the types of products. So they're mass producing tampons and pads. And in the short term, you know, that's probably what most people want and are most familiar with. We've heard that, you know, cups could be great, not only from the environmental perspective, but also for people who are unhoused, because they, it's one product for the whole year. And if you're going through lots of different places, that can be great. But it takes it takes some education. It can be pretty intimidating to use a new product that's in what might be a sensitive area. So we need to do education in order to make sure that people are comfortable with products before assuming that that's what they will want.
Awesome. Thank you very much, Sasha. I, like Councilor Coletta stated, it's so apparent you've been in the game and that this is the work that we're happy that you're the one leading it, and so many other organizations. And like I said, I take that as a charge to me in my personal and professional capacity to be doing the work of destigmatization, and just appreciate the work and the potential of what we can do here through a pilot program and with our partners, and a commitment to be putting periods first. I won't make a pun. Thank you.
Thank you. Councilor Arroyo?
Thank you. Going to echo my colleagues on thanking you for sort of the very informative overview of a number of different things. Some of what I was going to ask has already been asked because I have great colleagues, but I was put in charge of sort of the shopping for me and my loved one over the pandemic, and I am a infamous Googler of what I'm purchasing. And so when I had to purchase period products, I said, well, let me just see what the best one is, right? I know what she used normally, but I was just looking through it. And it was pretty stunning to find out just how many toxic materials go into the menstrual products and period products. And I remember just being like, did you know any of this? And it was actually not something she had been made aware of, but it was also, there was a wild fluctuation about, similar to like organic food as to non-organic foods, just in what the price points were for the different change. And there was a process there where we were trying to figure out what product made the most sense to get away from toxic products, but there was a comfort factor to that as well. And I think one of the things that I truly believe in when we talk about government purchasing or government power to buy product is that we have the ability to elevate a new brand or a new product into sort of public consciousness, but also the why behind why we do that. Most recently, we did this with our public schools and the procurement of a fresh foods contract. And so this is something where I see a very similar ability for the city here to speak with our wallets about what we are giving people access to in the city of Boston, what we are enabling access to. And I think you brought up something that is very, very interesting and also frustrating, which is that many of the folks that step into the charity space are some of the worst actors because it's sort of conscious cleansing and brand cleansing. And that's where the products tend to go. They also are usually able to undercut on pricing. But this is one of those instances where I think if we're doing a pilot program at this scale, I think, we were talking about $20,000, $30,000 for the city in terms of what they contract and what they budget. That's really not a whole lot. And so in this instance, I guess my question would be, and you've sort of spoken on sort of Always and other brands that we should try to avoid, are there brands beyond what you've mentioned that could scale up with a contract? Because I think what often happens is we see these smaller brands and we say, well, they can't meet the whatever that need is. But this is a specific one where we are sort of talking about a pilot where they can grow as the pilot grows. And so are there any other sort of brands and or specific things to look out for from the toxicity for health standpoint? So I know there's an environment concern, but for me, I'm gonna be honest, when I was looking at this, it wasn't like I cared much about the water. I cared about my partner's health, like way more, and that wasn't even close. And so from the standpoint of brands that really specialize in taking care of the product and what you're putting into your body, are there any suggestions for exact programs that the city should be partnering with, and then how we can sort of incorporate doing good? So for instance, if it costs more for the city to help that type of brand ramp up so that we can meet these homeless shelters and folks who need it. Because one of the things that you brought up, capitalism, one of the worst parts about that is that generally speaking, we are giving the most vulnerable the least beneficial products. And so I want to make sure that if we are trying to sort of create this program, which we are from sort of the ground up, that we are starting from a healthy foundation of what products we're putting into our system. So I know that Rusi asked you sort of for some of them, and there were some really great local ones. Are there any sort of bigger non-local ones that do the right thing? Because I also think for folks who sort of vote with their pocketbooks, it would be a good moment just from an educational standpoint to say, hey, if you're going to a local store and you're looking at them, these are brands that sort of do the right thing. You don't have to necessarily call out the ones that don't, but you're welcome to do that as well. I'm good with that too.
Off the top of my head, I honestly can't remember many more product companies other than I think Pads on the Roll is really interesting because you don't need to install a new dispenser. So for a low-cost solution, you can use the roll that the toilet paper is on to also put the pads on a roll. I probably should have brought them for a visual in case it's confusing, but they're covered in their plastic case and they're perforated, and it's on a roll like toilet paper.
Which means that you can essentially just pop in the same toilet paper holder, which maybe costs like $2 or $3 at a Home Depot, and put them anywhere.
But they're only pads. I think the other maybe thing though that's making me think of is period pain, and especially when we're looking at what we know about period pain is that women of color are disproportionately impacted by endometriosis and PCOS, and they're also underdiagnosed. And so with all of this new talk of period poverty and taking away the period tax, it's also brought attention to the period pain that so many people experience. And how is it that in 2023, the best recommendation people have for dealing with period pain is Advil, which was never made to handle period pain. But there is new innovative solutions that healthcare companies are coming up with to have droplets and vitamins that respond to the hormone levels that are actually changing during menstruation, so that there could be more holistic ways to addressing that. So I would love to see the city's public health committee also take up how we can provide more health solutions to people being able to diagnose themselves with a medical professional earlier and have access to their life again, because those people are missing school, they're missing work, they're often not able to get out of bed for a week every single month, and that's really debilitating. And I think I would love to see Boston as a home to the health and tech hubs of the world invest putting that medication, real medication that's really meant to actually address periods, front and center as well.
I really appreciate you bringing that up. I think that's something we could mix into a vending machine sort of idea of putting that all together. I'll know, in terms of what you're speaking to directly, I've had multiple nieces, different nieces, who have had to actually be hospitalized due to their period and complications with it. And there was like really scary experiences for both of them. And so from the standpoint of how we can prioritize not just product, but the medication specifically to like these things, I think if that's another thing that we can incorporate into this, that would be a great step forward in both. I think one of the things that is interesting to me as sort of a man who is used to having like man colds and being very vocal about when I'm in pain or sick is the level that those around me that are women have gone to not show how much pain they are in or how they are feeling because of stigma to that. And so anything we can do to put medication front and center that is specifically tailored to this, I think normalizing even that is incredibly important. The idea of being not in a good shape because you are having this thing happen to you physically, rather than suffering in silence or trying to hide the symptoms. I think having us put medication or anything like that into something that is equally accessible is really smart. And so whatever we have in terms of that for branding or for specialized product, I think that's something that if you don't have it now, but I think it'd be a great idea for us to roll into this pilot. And so I'll leave it there, but that was really helpful in sort of setting a direction that I think we can really go with this to make this one of the better programs that does this in the state and the country. So thank you very much. Thank you.
Thank you, and thank you again to my colleagues for asking great questions. A few things you said that just stuck out that I want to highlight. And it seems to be the theme too about the education, right? And I know as a mom of 4 children, 1 daughter, and I grew up in a family where you educate everyone, not just the girls. So I feel like that was fortunate, because I know many of my friends and others I hear now, like, just it wasn't what we did. Growing up in an Irish Catholic household, it seemed a little crazy to me, but it was just how, and now I look back and think, well, that's how it should be. And myself in high school and as a teacher for over 20 years, knowing that shame when girls feel like they have to, where am I going to put my pad or tampon if I have to get up? And do people know? And we know that at all ages, not just teenage ages, that you think people are looking even though they may not be, and that can just cause a lot of stress, mental health, which brings me to that idea of we're talking a lot, and one of the things one of the reasons I ran for office, right? But we talk a lot on this council about advocating for more mental health supports. And when we're tying it into the budget, $28,000 per student spent. If we just put $10 per student in that budget of we have like $1.5 billion. If $10 per student, which we may not even need that much, we'd have $500,000 to make sure that every school across the system has what they need to provide our kids, our children who need this. Also, staff. Another thing I know in buildings, it's the staff that sometimes needs that too. And you laugh because you're older, but it's like, oh, I have to now go ask the nurse to get the key to go to that weird closet in the back of the principal's office to open some stash, which then reminded me, our nurses, and I know you tied in the custodians, so I totally appreciate contracts and change of, job descriptions, but we can make it work, and I know they would want to make it work, but we do have to be cognizant of that. And last week I held a hearing on youth summer jobs, and it tied into nurses maybe being able to help with the working papers, signing off if they've already had their physicals submitted. So just how do we make government work where it's easier? In nurses, we do have a budget that nurses buy Band-Aids and aspirin. We just need to put that into their supply budget, or how we can make it work. So I know that the sponsors of this and all of our colleagues will put our heads together to make sure, because this seems like something that we should just make happen. Just that other comment you made about moving it from the nurses or the putting it in the bathrooms, and I know earlier too, speaking of other public spaces, but knowing that you don't have to let anyone know what you're doing or where you're going. You just go and do it. And it's where you need it to be. And you don't have to make sure you brought it from home, or a friend passes it across, the table and then maybe gets in trouble. But so definitely lots to talk about. And this always tying in with the nonprofits. Some of my best days on this job have been went to a couple schools with Katie's Closet, and just thought it was so amazing that we were stocking shelves with hygiene products, that this was something they knew. And the schools that are fortunate enough to have, the nonprofit like that, most people think it's just about the clothes, which is a whole other social conversation we could get into. But the products, if it's, shampoo, deodorant, toothpaste, but obviously also menstrual products are so important. So just thank you for your knowledge and always giving us ideas to go forward and advocating. So I'd like to just ask the sponsors if they want to close out, ask any other questions before we see. I know that we've checked, there is no Zoom public testimony, but if there's anyone, I know no one has signed up yet, but if there's anyone here who wanted to testify before we do closing statements.
Please stay welcome.
I think we're good, yeah.
Thank you, Sasha.
Thank you.
Sure. So I just want to say thank you to everybody. This has been an enlightening conversation. I am surprised at how behind Boston is on this.
In the Commonwealth.
In the Commonwealth. There's 21 states who's already done this. There's other municipalities in the Commonwealth who have made menstrual products free and accessible in public schools and in municipal buildings. So we have a lot to do. to actually realize and promote menstrual equity. So I did hear, and I always love to summarize marching steps and what we learned in this conversation so that we know exactly what to do moving forward. So I've broken it down to city policy and budget efforts, and then Boston Public Schools, other municipal buildings, and then who I want to include in this conversation. But in terms of city policy and budget efforts, we obviously need to get this pilot program off the ground, trying to get women's advancement, real dollar investments and resources to get whatever these dispensers look like, whether that's vending machines, boxes, et cetera, utilizing the voice that we have as a council and our budgetary authority now to move different line items or amend line items in the operating budget to get her some more resources for this pilot program. And I heard 125,000, give or take, maximum is what she needs. So I'll be thinking about that and prioritizing that during this process. I did ask what it might look like in the interim to get these products into the hands of community and nonprofit partners, and things like Katie's Closet and BPS. And so I really look forward to that follow-up conversation that I've requested with Women's Advancement to discuss what this procurement might look like and how we can utilize the surplus of funds to take immediate action into getting these products out into the hands of folks who need it most. Regardless, though, I do love the fact that in this conversation we did talk about the need to be intentional about identifying where these reproductive health deserts exist, ensuring that anything we do are serving our most vulnerable populations, low-income individuals, immigrant or migrant families, and always putting them at the center of every single discussion. And separately, just considering best practices and thinking about large-scale procurement, right, and how government purchasing could be a statement of our values. So tying in our climate and environmental goals, thinking about biodegradable products if we are thinking about doing anything when it comes to procurement, and then supporting local startups and WMBEs who are doing this work. I think that's really, really important. So placing an emphasis on that. In terms of Boston Public Schools and other municipal buildings, thinking about the large-scale procurement, and thank you so much, Sasha, for bringing up the economic argument to this. It's cheaper to buy in bulk, so that is certainly something to consider when we're in discussion with BPS, and the equity lens on all of this, having our kids be able to access these products without going to an adult, and breaking down those stigma barriers, that shame, especially for our trans kids too, is super important. So thank you for uplifting that. And the janitor contracts were mentioned as well. So just moving forward in upcoming conversations, I definitely would like the Boston Public Health Commission here just to talk more about education and health solutions to identify reproductive health care priorities, whatever's on the docket for them in the coming fiscal year, and to talk about healthcare-related pain issues like endometriosis. I hope I said that right. I have gum. Endometriosis. And I would like to just encourage everybody to consider and look at what Spain did recently, which is to have a menstrual office leave plan. My office instituted this last year, where everybody, men and women, no matter what you identify, you get one day. It's a personal day that is not docked in the event that you get your period and you are feeling some sort of pain. So would encourage everybody to maybe look at that and institute it. And then going back to who I would like to have in these conversations, obviously Boston Public Schools, Office of Health and Wellness, and potentially facilities to discuss what this can look like now as we wait for state legislation requiring this of all public schools. So I just want to thank my co-sponsors, Councilor Louis Jean, always a strong partner in this work and strong champion of reproductive health care and justice. My colleague, Councilor Arroyo, thank you so much for being an ally in this work. I appreciate you being here. And thank Councilor Murphy as well for chairing and her work on this, and to the advocates that came and folks in the room. Thank you.
Thank you to the sponsor for your leadership on this issue, for being centered in this. I am now like even more outraged. I am upset at our failure of leadership here in the Commonwealth and in the city of Boston. And so it's a collective commitment. I think Councilor Coletta summarized everything. And so I don't have much more to add, especially I'm going to another women's event where this is what I'm going to talk about. I'm going to just make sure that all I talk about is period poverty and period equity and our failure to really be leaders in this space. But I will also say thank you to the administration, because I know oftentimes, even if it's, the Women's Office, Office of Women's Advancement, if it's their priority, there's so many competing priorities of the administration, but our role is to center what we hear is important and what we know is important. And to you, Sasha, for elevating, as a Black woman, the number of stories I hear, and I know of folks, who are suffering from endometriosis and PCOS and fibroids. And, we know that when white folks catch a cold, we catch pneumonia. And so it's no different here when we're talking about folks who are menstruating and we're talking about access to products. And so I just want to thank you, and I want to thank all the organizations that are really centered in this work, that really center Black women in this work, like Love Your Menses. And Councilor Coletta, I'm glad you took a list of the work we got to do, because we got work to do. So thank you.
Yeah, I'll just repeat thank you to everybody who's done work on this. This is a justice issue and is well overdue. I think, when we see the numbers for just how ridiculously behind Boston is as a major city and Massachusetts is as a major state, it's never usually in alignment with how we perceive our own bureaucracies. And so this is something that I would like to see us sort of escalate up the list as quickly as possible for resources and for getting this started. I want to thank my co-sponsors for their leadership on this, and our advocates and volunteers and just interested constituents and administrative folks who lift these things up on a daily basis and continue to do what I consider to be true justice work. And so I'm hopeful that we can get this done in relatively short order. And I look forward to future discussions and sort of putting numbers on this and sort of putting our money where our mouth is on this. And so I am very excited about where we're going from here. And I think that this hearing, as sort of an educational tool, as a laying out or making a case or an argument for why this is well overdue, was very successful in doing that. And so I'm grateful to folks who gave their time and their platform to help make this possible. So thank you to all of you.
Thank you, and thank you to the sponsors. I know that this will stay in committee because we're just beginning, and just the conversation was great and uplifting, that this is, this is a necessity. It's not an extra. I think back when my daughter, outspoken in a good way, but would say, hey, don't be putting menstrual products like in my Easter basket or my Christmas stocking. Those aren't like special. Those are necessities. It's like feeding me, right? So we definitely. Their Easter egg basket? Well, don't you put toothpaste, new socks? Well, I don't know. We can talk later about that. But it's not like you're gifting someone like those, like when someone gets nice shampoo or nice cologne they wanted, and then you get a box of tampons. Not fair. It's necessity. So thank you for continuing to uplift this. We just need to keep talking about it and having the conversations in spaces like this where we can make policy changes, and working alongside Moya. I know when I met with her last week, found out, which I wasn't aware of though, that when we added the early childhood department in the city of Boston, it really tore a lot out of that because it used to fall under that umbrella. So she has a much smaller workforce. So I know we advocate for lots of the great departments across the city. So I will be, and I assume alongside my colleagues, advocating to grow that department so she can help us with that work, because that's where it's going to come out of. So thank you, everyone. With that, this hearing is adjourned. Thank you.